know that I have positive neurological findings. Okay? Make sense? When you get to MSK2 with us, then we're going to look at entrapment sites of each one of those nerves. We're going to do palpation, we're going to do Tinel's test, and then we're going to talk about conditions that these match up with. Okay? Right now we're just doing the basic test. Okay? All right. And the Olson book is the simplest.
Weird.
They're the best videos for upper limb tension tests. He keeps it very simple and straightforward. Okay, so if you're not sure of all the components, he does a really nice job of making it very concise. Okay, so
Or he just wants
I
to
have
say
no
that.
history.
You look like a gender.
you signed the papers anyway.
That's beautiful. Cookie.
No, I don't think so.
Today is a quad and glute day. Right, so slide just a little bit. There you go. Okay. And let's see here. It's a nice neutral neck position. Okay. So I'm going to depress the scapula. Okay. I'm going to do wrist extension. Right. Forearm supination. Okay. I'm going to use my thigh to bring them forward. External rotation of the shoulder. Okay. And then I'm going to do elbow extension. You can tell me if there's any symptoms. And these are very slow, just like this. It's not abrupt, they're very slow. Any symptoms?
I'm getting shoulder pain.
A little shoulder pain. What happens when I do that? Worse, better, same. Okay, so I took off the depression, so I'm not going to add the depression. How about now? Worse, better, same? Same. Okay.
Oh, yeah.
You're not going to ask them what type of pain, or are you just assuming it's like?
Yeah, I mean, of course you are.
Okay.
Yeah.
What kind of pain?
What kind of pain?
It was like sharp.
Okay. How about now?
Different.
Anything?
No,
Okay.
just tight.
Okay, so right there, I get a lot of resistance, so I'm not going to push them all the way into extension because I feel the resistance. Slide your head away from me. Keep your face. Worse, better, same.
Tight.
Worse, better, or same.
Worse?
Okay, back to the center, and then slide your head towards me. Better. Okay, back to the middle. Okay, so the structural differentiation was when he bends his head to the side, that's going to cause increased tensile load on the nerve, increases symptoms. When it came towards me, that's going to take tension off the nervous system, and that's decreases symptoms. Okay? Yeah. So let's say, last case, let's just say he was our patient, and we went here, and this was a positive sign right there. My fingers are tingling. Okay?
Positive.
Positive sign. What I use that for is patient education. Remember we did that test when I was winding up here, and you had symptoms right here. Your environment that you live in, everything you're reaching for and grabbing has to be within that zone. Every time you go outside, you're stretching the nerve and causing more tension, causing more inflammation in the nervous tissue. So that's really what I use that for a lot of times. Okay? But it's part of the cluster. Reproduces symptoms. Check. It's one of the 5. Good?
Did you go over how you would document that?
No.
In your note?
No.
Yeah. So you would take a goniometric measurement, usually at the elbow, how far he can extend. And so the PT that comes behind you knows how much extension in the elbow that he had. Yeah.
Is that a question or a question stretching?
Yeah. Can you also measure, let's say, at the tightest joint of the nerve tension test? Like the one with the most decreased range of motion?
You can. Most clinicians will go to the elbow because it's easier for everyone to understand how much extension they had there.
Okay. Because these components are already put on.
Yeah.
Right. These components here are already put on. Elbow is the last one. Right. Good? Okay.
Wait, were you depressing his shoulder?
Scapula. Yep. Right, so that's not a severe depression, but just a firm, glide it down, and then I'm gonna lean on my arm. If this table was higher, I'd be leaning on my arm to hold that. Put them in those positions.
So compression, extension,
Yep.
extension, external rotation.
Yep.
Or supination.
Supination.
External rotation.
Yep.
Elbow.
Yep.
Is that the ulnar nerve, right?
No, this is median nerve. This is the base test. ULTT 1. Here's what you got to understand. If you look in this book, it's called the upper limb tension test. If you look in this book, neurodynamic testing. If you look in this book, ULTT 2A, 2B, whatever. Just know what you're doing. This is the median nerve, and it's also the base test for stretching the brachial plexus, right? So this is that test that is positive for the cluster, and more than likely, if you have 4 out of the 5, more than likely the person has radicular or radiculopathy. Make sense?
And the terms in Ulnar are what are on your comp exam.
Yeah.
We keep repeating that over.
Olson, Olson, Olson,
My best
Olson, Olson, Olson.
So done.
What book? Olson.
Done.
Right? When we get to extremities in MSK2, what are you gonna hear? Dutton. Dutton. Okay?
Good thing I already got
Right,
the book.
for spine, we're doing Olson.
Here, it might be-
Can't be clear enough, okay? All right, radial, we'll do one more.
Oh, you're gonna do radial?
Yes.
Can you try Ulnar on this one?
Yeah, later. Yeah, that's not for you. Okay, can you, like, cattywampus on table, meaning a diagonal? Okay. That's an Australian term, but keep your feet up. Cattywampus is an Australian term. Okay?
Never
All right?
heard that.
So my thigh is going to depress the shoulder, right? The only reason, Olson shows straight on the table. The only reason I make this modification, it gives the patient room to side bend towards me and away. Okay? Just a clinical preference. Does it make sense? Okay. Uncross your legs, please. Thank you. Good. So I'm going to depress. I'm medially rotating the humerus. Bringing the thumb in, wrist flexion, full wrist flexion, full forearm pronation, and now shoulder extension. And now the last thing I'm adding is elbow extension. How you doing? Any symptoms? Nope. Just tight. A lot of resistance right there. Any numbness, tingling?
No.
Okay. Any stretching?
Yes.
Where?
My forearm.
Okay. So right there is the end. Okay. So let's just say, for example, on this one it was here. I would measure that elbow flexion moment to see what the range is. Make sense? So I have a little depression, and then I can say, okay, I'm at the limit. Can you move your head towards me? Worse, better, same.
Same.
Okay, back to center. Can you move your head away? Worse, better, same.
Same.
Okay, back. So it's probably just a muscle stretch.
How are you gonna get the measurement?
Couple.
Yeah, the goni, but like, it would be that.
Would you have to
How
have
do you think?
somebody else do it?
Your PTA.
Yeah. that's what I'm
PTA,
saying.
or I have a goniometer right here, and I slap it here and get the best measurement I can.
Someone get him a goni.
Okay? Does it make sense?
Yeah, yeah.
Right?
And a normal response would be no numbness or tingling, correct?
Or any pain.
Anything.
Right.
So,
So he told me he had some forearm stretching. When we move the head toward, worse, better, same, same. Move the head away, worse, better, same, same. Not neural, musculoskeletal, probably here. Muscle tightness. Good? Okay?
What is that one? Shoulder depression,
Shoulder depression,
wrist flexion. Oh,
internal rotation, wrist flexion, pronation, and the thumb tucked under, because I'm trying to stretch the radial nerve. The sensory branch ends on the radial side of the wrist. Okay, so I'm trying to pull it in, and now trying to do elbow extension. Okay, so we're winding up the radial nerve. Okay,
We call that handing off the baton. to
That's right.
Right? Or tipping the weight.
Oh, nice.
That's an old
Yeah.
fashioned.
Yeah. Okay, so practice those two. Shoulder external rotation, full supination, wrist
Extension.
extension, fingers.
Extension.
Okay, am I worried about these or more of these?
The fingertips.
Okay, so I'm worried more about the lateral fingers because sometimes your hand is too small, so then your focus would be here. Make sense? Because I'm trying to tension the ulnar nerve. Okay, and now full elbow flexion. How you doing? Symptoms?
A little bit.
Where?
My elbow.
Okay. Can you bend your head towards me? Worse, better, same. Okay. Back to the center, and then to the right. Worse, better, same. Worse. Okay. And back. Test is done.
Yeah.
Okay, and I'm going to measure the amount of shoulder abduction, right? Because the test is shoulder abduction should be the 90.
Yeah.
Does that make sense? So he had symptoms right here. Then I did the differentiation and made it worse. Okay, he's got a positive ULTT3, upper limb tension test, ulnar nerve bias. Make sense?
Yeah.
Mhm. So as soon as the symptoms come on, you're done. And then you do your structural differentiation, and then I would measure the amount of shoulder abduction.
Question. So, the ULTT3, right? You would measure it with the amount of shoulder abduction?
Correct.
So if he didn't get any, you would just take that measurement, and that would be like positive finding with this amount of degrees
Yep.
of motion. Okay.
Yep.
Cool.
Does that make sense?
Mhm.
Because then the progress would be working towards getting this. Okay? So all of you, if you wanted to see what your ulnar nerve tension is, do raccoon eyes.
Oh my god.
Oh, we used to do it in like middle school.
Is it about it?
Wait, if you can't do it, what?
Oh, with the tension test.
Bad.
So if you can't
So
do
it's
it,
pretty
bad.
close to what.
so if you can't do it, then that's bad.
That's bad.
Dang.
Okay, practice that.